Hello viewers, I'm David. I'm a qualified nurse based in Kenya. Welcome to my channel. Don't forget to subscribe to get more lessons. So in this lesson is about bacillary dysentery, and I'm going to go through the following: causative agent of the disease, pathophysiology, clinical features, diagnosis, treatment, nursing diagnosis, and prevention. So stay tuned to the end. So first of all, bacillary means related to bacteria. Dysentery means severe diarrhea containing blood and mucus. So in general, it means bacteria that causes severe diarrhea containing blood or mucus. Okay, on prognosis means the likely outcome of a disease. So some people feel better in a few days even without treatment, but others it might develop into a life-threatening condition. Yeah. So the incubation period for the bacteria that can lead to dysentery is 1 to 3 days, but it can be as long as a week. People with bacillary dysentery should isolate themselves for 7 days to prevent infecting others. So bacillary dysentery, also known as shigellosis, is an acute bacterial disease of the intestines. It is common especially in areas where the standards of hygiene are low, particularly where there is scarcity of safe water, improper human excreta disposal, large population of lice, and child malnutrition. Once again, humans are the only known reservoir. On causative organism, it's caused by non-motile gram-negative bacilli of genus Shigella species. The organisms responsible for outbreaks are Shigella soni, Shigella dysentery, Shigella flexneri, Shigella bodi. However, the first three organisms are the most common causes of outbreaks. On causes, food preparation by someone with poor hygiene, ingestion of contaminated water, sexual contact especially involving the anus. So viewers, we are talking about the disease that is oral fecal. So there has to be a transmittive factor that brings the stool to the mouth. On mode of transmission, the mode of transmission of the disease is fecal-oral route. The organisms are transmitted directly through flies or contaminated hands. Indirect transmission may also occur through dishes which are poorly washed. The Shigella multiply in food, which when ingested cause dysentery. On clinical features, the disease has a short incubation period of 1 to 4 days. The onset is sudden with fever, headache, diarrhea, with streaks of blood and colicky abdominal pain. When we talk about colicky abdominal pain, it's the pain that comes and goes. After a few motions, usually in a few hours, diarrhea stops and is followed by severe colicky abdominal pains known as dysentery syndrome. This is so important, viewers. And painful contraction of the sphincter ani, which produces an irresistible urge to defecate, which is also known as tenesmus. Tenesmus basically means when you have the urge to poo or pee, but when you go at the toilet, it doesn't come. When the patient goes to the toilet, they pass small amount of purulent mucus and blood. Vomiting may occur. Toxemia. Toxemia, it means toxins in the blood. So these toxins are produced by the Shigella on the wall of the colon and may be absorbed in the bloodstream. And it may cause high fever and rapid pulse. Then dehydration, of course, with a frequent diarrhea. And in infants, it causes rectal prolapse and may cause also convulsions. On diagnosis, We do stool examination, which shows the presence of blood and mucus. Stool microscopy, which shows presence of large number of white blood cells and erythrocytes. Stool culture to show Shigella species. On management, antibiotics, oral ciprofloxacin 500 mg 12 hourly for 5 to 7 days. Okay, you also should look out on the side effects of this drug because they are normally severe. One of it is normally the Steve Johnson syndrome, where it's like an autoimmune condition where like the body reacts in form of producing breakouts on the skin, especially in the mouth and the private parts. So you should also check out on them. Also analgesic for colic pain such as codeine sulfate is opioid analgesic, and also anti-diarrhea loperamide and paracetamol, you can use it. Then rehydration due to diarrhea and fluid loss, oral rehydration solution in water is always useful as an aid to parenteral rehydration. It also carries less danger of disturbing electrolyte balance. However, intravenous fluid should be given to a very ill who cannot take anything orally. Then on nursing diagnosis, diarrhea related to enteric Shigella infection as evidenced by frequent low stool. Fluid volume deficit related to active fluid loss through vomiting, diarrhea and sweating as evidenced by dry mouth. You can also say dry skin. Yeah. Then risk for infections related to toxemia. So you've said in the colon the toxins can get access to the bloodstream, then they cause toxemia. On prevention and control, safe water supply, improvement of personal hygiene, digging and use of pit latrines, practicing food hygiene, giving health education that emphasizes environmental hygiene and breastfeeding, inspection of public eating places, markets, boarding schools and camps. Don't use water unless you are sure it's sterile, meaning safe. Stay away from ill people. Thoroughly cook all food. Wash all fresh fruits or vegetables with clean water or peel before eating. Thank you so much for watching. You can check out my other videos. Don't forget to subscribe, like and comment. Bye.